Hello.
Raghav, can you start on your video?
Yes, sir. I have already started on my video, sir.
Okay, thank you, Raghav.
Yes,
and Dr. Karpakavalli, how are you?
I'm good, sir.
Okay.
Afternoon, sir.
What participant of your team?
Dr. Giegel, Dr. Nimish, and Sister Nilima.
Okay, Sister Nilima, Dr. Nimish, can you put on the video?
I have put on my video, but I think there is some issues with camera. But
All right,
my
fine.
video is.
Dr. Nimish, you're from Northern region, right? Northern zone. Yes, welcome. And Dr. Giegel?
Thank you, sir. Yes, sir.
Fine, fine. So from there we go to South. Of course, I can see Dr. Stanley. Where are your other team members, sir? Who are the others from South? Hello, can the South Zone team members identify?
Dr. Ravi Kiran, I'm not seeing. Sangeeta is here.
Sangeeta is there, you are there. Ravi Kiran, who else is there apart from that?
B. Jhansi.
Jhansi also, I'm not able to see.
And Subba Lakshmi.
Subba Lakshmi. So I can't see these 2-3 people.
Yeah.
Okay, East. Who are the people from the East?
Sir, this is Dr. Suchira Shah from East Zone.
Okay, where are you from, ma'am?
I'm working in Institute of Neurosciences, Kolkata as a rehab consultant rehabilitation physician.
Very good, very good. Okay, Dr. Nandan?
Sir, I am from Manipur, sir.
You're from?
Manipur.
Okay, Northeast that is. Right.
Yes.
So, Eastern region, can people please identify?
Yeah, I'm Tanya.
Yeah, Tanya. Yeah.
Yeah, I'm working in Rumavedana Hospice,
Okay.
Kolkata.
There are only 3 of us are there. I think the
Yeah,
other 2 members have not joined.
Yourself, Suchita and Dr. Jyotirmay.
None.
Tanya is there.
Yeah.
Mrs. Tanya is there, and Dr. Nandan is there.
Okay. So, Dr. Nimish is Northern region. Okay,
Yes,
so
sir.
Dr. Nandan, Dr. Tanya, and who's the third person?
I'm Dr. Sucheta.
Oh, Dr. Suchita. Okay, fine. Who was the fourth person?
Abhishek and
Dr. Abhishek.
Name yourself?
Yeah, they
Yasmin.
haven't joined.
Yeah. Okay. Yourself. All right. So, yeah, South is over. So, can I go to the Western zone? Can the team members?
Sister Samran, and 2 from GCRI.
From the West zone, everybody is there. From the South, one person is not there. From the East, one person is not there. So, who are the people from Northeast? Dr. Bharat, where are you from?
Sir, good afternoon. I am from All India Institute of Medical Sciences, Jodhpur.
You're not part of Northern Delhi, is it?
Sir, from Jodhpur, Rajasthan.
Okay.
West side, sir.
Okay, Rajasthan. Fine. Right. So, you are
Team 5, and in our team, Dr. Seema Partrani, Professor, she is there. Jyotirmay nursing staff is there.
Yeah.
Other members I am still searching, but they can say yes if they are online.
So, who are the other members? Research say.
Central Zone.
Yeah. So, all you guys are from Central Zone, is it?
Hello.
Yeah, go ahead.
Hello.
Yes, go ahead.
I'm Dr. Rekha. I'm Dr. Rekha and Dr. Gurucharan from Central Zone.
Okay. So, who else is there in the Central Zone from you?
Sorry.
I think Dr. Bharat.
Dr. Bharat is there.
Jyotirmay Dinwal, Senior Nursing Officer from Central Zone.
Okay. Right. From Northeast, who are the people from Northeast?
Jyotirmay, Seema
Sir, I
Partrani,
am Dr. Nandan, sir.
Bhaskar.
So, you are a part of Central Zone?
No, sir. Northeast Zone. I mean Eastern Zone.
Eastern Zone. Okay, fine. So, I think we are already running about 5-7 minutes late. Can we now go ahead and start the quiz? I want to share this screen.
Can you tell the instruction once?
Yeah, I'm going to tell you.
Sorry.
All right, a very good afternoon to all of you, respected dignitaries on the other side on the Zoom platform, and some of you are, sitting physically in your place and watching the quiz. A very big thanks to Dr. Anjum and her entire team, the organizing secretary of Bhagwan Mahavir Cancer Research Center, for hosting this wonderful program. So this is a perfect fit post-lunch when most of you will feel very drowsy and want to go to sleep. We are going to kick your brain. We are going to make you alert and literally make you sit on the tip of the chair and get your thinking absolutely activated. So are you guys ready?
Sorry.
Hello, are you guys ready?
Yes, sir.
Yes.
So I'm going to share the rules first. Okay. So first what I'm going to show you is a generalized rule. Okay. Now each team to have a mentor who will facilitate the discussion within the team and participate. All right. The mentor can also give the answer if required. So mentor is going to be part of the team and he will facilitate the discussion whenever required within the team, within the time allotted, and he'll come back. The second general rule is response to questions will be given by a designated person only in the fastest finger round. This designated person can be anybody. It can be mentor or it can be anybody as the person chooses. Okay. And also the most important thing, no rounds will be passed on to other teams. These are the general rules. General rules are those which is going to, kind of govern all the other rules for the round. Okay, from here we move on to the next round one, and we choose to call this round as medical trivia round. So the rules are, this is a team-based round. Each team will be given 5 questions turn by turn. So team 1, team 2, team 3, team 4, team 5, that's how we'll go. Okay, then each question will have 4 options. Okay, and after the question is read, within 10 seconds, you can discuss and respond to each of the questions. And then you have no negative marking. And each right answer will earn you 10 points. So it's either 0 or 10 or 20 or 30, 40 or 50 if you get all the answers right. Okay, are we ready? 10 seconds. Are we ready?
Yes, sir.
Yes, sir.
Yes, sir.
Yeah. Pallavi,
Yes.
are you there? So you're going to be managing the score, right? Hello, Pallavi, are you there?
Yes, I'm there.
Yeah. So you're going to be looking at the score. So this round, it's of 10 points for each of the questions. There are 5 questions and therefore 50 points. Anybody has any doubt vis-a-vis this? Come on, answer. Anybody has any doubts?
No, sir.
Okay. So here is team 1. Who's team 1?
So
Sir, can we have the timer, please, to know the 10-second time limit?
Yeah. How will they know the 10 seconds is over? So I'll have to verbally announce. So here is a co-host who will be announcing to you that 10 seconds is over. So all of you be very, very alert. Is that fine?
So is it possible to...
Raghav, am I
Sir, probably, is it possible to show it on the screen, sir?
Yes, sir. The timer on the screen, sir.
It's not possible because we are working on 2 different, laptop.
Okay.
But you can have one of you timing up. I mean, we assure absolute transparency. So I don't think there'll be any issue. So we have a person who's keeping the time. And
actually, sir, we all are at different places. It will be difficult to communicate with each other in just 10 seconds without knowing the time.
All these things were discussed during this. So we will tell you the time. Now, I'll tell you this is the time that starts.
Okay.
Right?
Sir, do we have to unmute and say?
Yes. Right? Okay.
Anyone can unmute, na, sir, in the group.
Right. Anyone can unmute. Okay. So team 1. Who's team 1?
Not zone, sir.
Not zone. So who's going to be from not zone? Anybody. So Raghav Gupta, Nimir, Gegal, Karpagalli or Nilima. Anybody can answer, this thing. Okay. So here we go. ready, steady, and all the very best to all the participants. You'll do a fantastic job. And here we've got the clock ticking. So the question is, which of the following is not a suitable adjuvant analgesic for the treatment of neuropathic pain? Okay, your time starts now. Nortriptyline, mirtazapine, gabapentin, or venlafaxine?
Venlafaxine.
Okay, your time is up. Who answered venlafaxine? Hello, who answered venlafaxine?
Atpagavalli, sir.
Okay, now the correct answer is mirtazapine. So Pallavi, please note down. Okay, so team 1 answered this question. They have got no score because they gave a wrong answer. Second questions to team 1, again Northern Zone. Which of the following frameworks is useful in engaging people in ACP? Your time starts now. Biopsychosocial model, trans-theoretical model, biomedical model, or the 4 boxes paradigm? Your time starts now.
Biopsychosocial model.
Okay, who answered that?
Raghav, so I
Raghav.
answered.
Okay, so let's see whether you're right. The answer is trans-theoretical model. So, sorry, the second also you got wrong. Pallavi, I hope you're marking. Correct?
Yes, sir. Yes, sir. I am.
Okay, thank you. Question number 3, again to North Zone, team 1. A 33-year-old female with metastatic melanoma presents anhedonia, low mood, and decreased appetite. Consulted team started her on duloxetine. What best describes the mechanism of action of duloxetine? Your time starts now.
So the options, sir?
Serotonin reuptake inhibitor, serotonin and non-adrenaline reuptake inhibitor, GABA agonist, and selective noradrenaline reuptake inhibitor.
B.
Serotonin, okay, B.
Noradrenaline
Right?
reuptake.
So let's see whether your answer is right. Yeah, you're right. B is right. Very good. Congratulations. Claps. Yeah, the audience are watching it. Please encourage them. All right. So we can now go to question number 4, again for Northern Zone. Here is your question. According to recent expert consensus, India ranks to which place for the quality of death and dying? Your options are here. 67th, 58, 59, and 69. Your time starts now.
58, 58.
67.
58, 58, 58.
Make up your mind. Is it A or B?
58, sir, 58.
All right.
A is the 67.
Okay, so you're between 67 and 50. Let's see. What is
58.
the chance? It is 59. So both of you are wrong. Okay. In the recent paper that was published, the quality of death is now, we have moved on to the 59th position from the earlier wherever we were. Okay. Question number 5. Again to North Zone, team 1. A 55-year-old patient with advanced hepatocellular carcinoma was noted to have a gradual 2-week deterioration of appetite, daytime somnolence, and nighttime wakefulness and confusion. Now, the family complained that he could not recognize his family members. On examination, he was cachextic, jaundiced, pale, and lethargic. Asterixis was also observed. There was also huge tender hepatomegaly. He is currently on a morphine mixture of 5 milligram Q4H. The appropriate next step would include, is everybody clear with the question? Yep, I'm going to the option now. Your options are haloperidol 1.5 milligram, stat and HS. Second, tablet rifaximin 400 milligram, TDS. Omit opioids as it can precipitate or worsen delirium, and all of the above. Yeah. Yes, Northern Zone.
6 seconds.
6 seconds more.
Sir, D, all of the above.
All of the above. Raghav. Okay, let's. Wonderful. Very good. All of the above. Right. Congratulations. Very good. Very good. So we now go on. Pallavi, before we go ahead to team 2, I hope you're clear with the scoring as far as the team 1 first round.
Yes, sir, I'm.
Okay.
Yes, sir, I'm clear. With
So
the
team
scoring.
2, who are the people? Team 2, who are the people?
So Tata and GCRI,
All
West
right,
Zone.
Tata and GCRI. Okay, team 2. Here we go. Yes. Team 2, can you please switch on your video?
So our videos on.
Oh, your video's on. Okay. Right. Thank you so much. So here we go. Question number 1. 78-year-old male with metastatic renal cell carcinoma who has tried sorafenib, idolium, and nivolumab and is refractory to all medical therapy, presents to the emergency department with intractable fevers and night sweats. What is an appropriate medication to give this man? The options are here: promethazine, paroxetine, hydrogen bromide, and naproxen or paracetamol. Your time starts now.
Naproxen or paracetamol. Option D.
Right, thank you. That's absolutely opened on a bang. Okay, thank you so much. So D answer is correct. So continuing, question number 2. The best position from which to examine a patient's oral cavity is. The options are directly in front of the patient, to the side of the patient, standing behind the patient, and last, sitting directly in front of the patient. Your time starts now.
B.
Hello, what is the answer, please?
B.
B. Sure, you're going with B? Okay. Your answer is wrong. It is C, standing behind the patient. Okay. Right. Question number 3. Again, for the team number 2. The mainstay of pain management at the end of life is radiotherapy, psychological interventions, pharmacotherapy, and spinal interventions. Your time starts now.
Pharmacotherapy. Sorry, pharmacotherapy.
Pharmacotherapy. Yes, your answer is absolutely correct. C. Very good. Okay. Question number 4. One of the main determinants of family satisfaction with end-of-life care is option 1, where the death happens. Option B, whether the patient died alone. Option C, level of care the patient receives. Option D, level of pain the patient is in. Your time starts now.
Option D, level of pain the patient is in.
Okay. Are you sure? Can I go ahead? Yeah. Your time stops now. Yeah. Wrong answer. The correct answer is where the okay. So we go to question number 5. Last question on this round for you, team 2. Which of the following non-pharmacological interventions involve patients in their care, giving them choices and allowing them to become active partners in their care? Controlled restlessness technique, A, your option starts now. B is energy conservation. C is relaxation techniques. And D is all of the above.
All of the above.
All of the above. Very good. Fine. So at the end of this first round for team 2, I think you got 3 correct and 2 wrong, right?
Yes, sir.
All right. Thank you so much. Now we go to team 3. Who's the team 3? Can you put on your video and identify yourself, team 3?
Yes, sir.
Yeah. You're on. Can one of you identify your name, please? Is not used in the management of pleuritis in the palliative care setting. Paroxetine, fluoxetine, rifampicin, and doxepin. Your time starts now.
Deoxypin.
Sorry?
D.
D. D or C? Now, can you ever tell me D or C?
D.
D. Doxepin.
Yes.
Okay. It is fluoxetine. B. Okay. So question number 1, wrong answer. Question 2. A 60-year-old woman with locally advanced cancer of the left breast presented with recent onset lymphedema of her left arm. She is not a candidate for radical resection, and due to her pulmonary comorbidities, she is unable to tolerate radiotherapy. Her examination shows a very swollen left arm, elbow, and wrist associated with ischemic changes in the fingers of the left hand. There is no radial pulse, and Doppler ultrasound scan shows no thrombus in any of the veins, however, reduced flow within her brachial arteries. What is the most appropriate initial management of her lymphedema? Your time starts now. Option is 1, multi-layer lymphedema bandaging, manual lymphatic drainage, furosemide and spironolactone, and D, compressive sleeve. Yes, your time starts now, please.
Multi-layer lymphedema bandaging.
Okay. A. Can we look at the right answer? It is B, manual lymphatic drainage. Sorry, the answer is wrong. Okay. Question number 3. Options to start a patient on opioid for dyspnea in the clinic will include morphine 2.5 mg Q4H, morphine sulfate sustained release tablet 30 mg BD, fentanyl patch 12 microgram per hour Q72H, and all of the above. Your time starts now.
It's a 2.5
A. Sorry?
A.
A. Okay. All right. A. So let me look at the option. Yeah. Wonderful. Correct. Congratulations. Okay. So question number 4. All of the following constitutes as
screen
and
sharing.
normal biochemistry. Your time starts now.
Options.
Quick,
I cannot
quick.
see the options.
Option D.
C.
Quality of life or abnormal biochemistry? Which of the following medication is not a therapeutic agent for management of hyperhidrosis? Antihistamines, corticosteroids, SSRIs, and 5-HT3 antagonists. Your time starts now.
D.
Sorry, be a little louder.
D. D.
5-HT3 antagonists. Okay, let's look at the correct answer. Fantastic.
D.
Correct.
D.
Sorry?
D for dog.
Yeah, correct. I got it. Thank you. So that's correct. So Pallavi, have you noted the score of team A at the end of the round? I think.
Yes.
Can you have the background, please?
Even mute my account.
Please log in from one device. Those who are there having food, please log in from one device. Okay. So now move on to team 4. Who's team 4? Can you come on the video?
Yes, sir. Yes, sir.
Who's there?
Yes, sir.
Okay, very good, Nandan. Yeah, here we go. Okay. Question number 1. Above what corrected QT interval measurement is a risk of torsion points, particularly 450 and 6. What time starts now, please?
450.
450 D. Okay, let's see. That was pretty quick. Wrong. The correct answer is 506. Right? Time 2. I mean, question 2. Sorry. Are you ready for the question 2?
Yes, sir.
All right. All of the following are contents of magic mouthwash except antihistaminic agents, antifungal, antitussives. Your time starts now.
Antitussive.
D.
D.
Had a seizure. What is the evidence concerning use of prophylactic anticonvulsants in patients with brain tumors who have not had a seizure? Okay, your options are anticonvulsants are indicated prophylactically. The tumor is found at the surgery to be hemorrhagic. Option B, there is currently no evidence to support use of prophylactic anticonvulsants even if patient is at the risk of developing. Option C, anticonvulsants will be needed post whole brain radiotherapy. D, anticonvulsants will be needed in patients with strong family history of seizures. Your time starts now.
Sir, B. There is no
There is
currently
currently
no
no
evidence.
evidence. Is it? Wrong. No, you know, somebody said C already from your team. Out.
Sir,
So
I
it's
told.
a wrong answer. Question 4. Please be alert. Okay. A 61-year-old woman was recently diagnosed with breast cancer and she's receiving treatment with methotrexate, 5-fluorouracil and cyclophosphamide. She presents with severe nausea and vomiting 2 days later. Her vital signs are blood pressure 1 Ag, the temperature 98.8 Fahrenheit, pulse of 75 beats per minute, and a respiratory rate of 24 breaths per minute.
Rolapitant.
So option B, rolapitant. Correct. You're right. Absolutely. Answer 4. So we go to the last question. Time starts now. Sorry?
Fentanyl.
Fentanyl. A. Okay. Fantastic. So that's the correct answer. So I think team 4 has done a fantastic job. Now we are moving on to team 5. Team 5, are you ready on the video? Can we see you on the video?
Yes, sir.
Okay. Okay, question number 1. Mr. Martin has locally advanced transitional cell cancer of the bladder with chronic pelvic and abdominal. Which of the following is most important in determining the maximum dose of oral morphine during dose titration? Your options are pain relief, constipation, risk of overstepping regulatory limits, and strength of the pill. Your time starts now.
It's the pain relief.
The most appropriate first-line treatment for the management of constipation is a stool softener and Okay, let's see that. You're wrong.
A.
The answer is A. It is a stool softener and stimulant.
Yeah, A.
In combination, yeah.
All right. Okay. So that's sorry, that was wrong. So we move on to question number 3.
It's A.
Okay, team 5, be ready, be alert. In the context of palliative care, family should be defined as blood relations only for clinical decision making, people considered by the family to be important, anyone whom the patient considers as family, and anyone who has direct previously. Okay, your time starts now.
Team 5, I see. C was the.
C.
Sorry?
C was the answer.
C.
Sorry?
C, sir.
C.
Yeah.
Answer was shown
See the
already
answer.
before
See
answering.
the answer before only, sir.
At the end of, we have filled the team round, right? First.
So we had 3 questions only.
So yeah, question, no, so team 5.
Yeah. 5.
No. You are already.
Right? We stopped here. So we now go to the next one, round 2. Okay, round 2. All right. Take a deep breath. This is a buzzer round. Fastest finger first.
Their problem.
See, there are a lot of background. There are people talking at the back.
Okay, should be
Everyone else, please mute.
Can I request the participants to mute? And if they are, coming from 2 devices, kindly switch off one device and be active only on one device. We have to ensure that the hand raise and the thumb raise is happening on our screen. So I'm going to just ask you a random question and all of you please raise your hand so we'll know. Is it clear? Where is the IAPC conference 2022 being held? Raise hands.
Dr. Rekha Chavan raised.
Yeah. So raise hand. Rekha Chavan, Stanisla raise hand. Ravi Kiran raise hand. Gregal Prakriti raise hand.
So
yeah.
Sir, how to raise
even
hand?
I raise the hand. Sir.
Yeah, Raghav Gupta raise hand.
Sir, how to raise hand?
There is a option of reaction if you look down. Just next to next to screen. Reaction.
Yeah.
Go to the reaction and raise hand.
Hello. Please load on. Once you have done with the raise hands, please load on. Is okay. Can all of you bring down your hand? Those have raised. In the meantime, can you see the screen? I'm giving the rules of this round. Can you see the screen?
Yes, sir.
Screen, please. Okay, so in all, we will have 10 questions. One spokesperson to respond. Seema Partani, please put your hand down. The third is raise hand, thumbs up option by any member, but answer by the spokesperson only. So once the question is over, all raise hand, thumbs up to delete the same. So what are we saying? All of you can raise hand, but then you have to find out who's the person who's going to answer this question right now before the round starts.
One doubt, sir.
Yeah, 1 minute. And then you get the time, 10 seconds. So team, before we start the round, has to decide about one spokesperson. Who's the one who will give the answer?
That's fine, sir. Spokesperson we have decided, but since we are in different places.
Yeah, so 10 people can raise their hands in your team, but ultimately it's the spokesperson who will answer this round. Is it clear?
Yes, sir.
Are you clear?
Any negative marking, sir?
No negative marking.
Okay.
Okay. Are you clear?
Yes, sir.
Yes.
So how are you going to assess who raised the hand first?
Is automatic. So there is an inbuilt system in the Zoom which will tell you who is going to raise the hand. Suppose that is regardless of who raises the hand. Right?
वर्ड हो तो वो बता देना आंसर उसका, ठीक है? मैं
Thank you. Yeah. So,
sir, from team 5 I will be answering.
What is who's the I? Bharat.
Sir, Dr. Bharat Paliwal.
From team 5 you'll answer. Okay. Team 1 who's going to answer?
Raghav.
Raghav will answer. Team 2 who will answer?
Jyotsna.
Jyotsna. Team 4, team 3 who will answer?
Geeta.
And team 4 who will answer? Dr. Nandan. Team 5 will answer? Team 5?
Sir, team 5, Dr. Bharat Paliwal.
Okay, I'm reconfirming.
Sir, just one more doubt.
Dr. Bharat, team 4, Dr. Who was that? Sangeeta.
For Dr. Dr. Nandan, sir.
No, wait. So let us clarify. Raghav will be team 1. Jyotsna will be team 2. Geeta will be team 3. Nandan will be team 4, Bharat will be team 5. Have I got it correct?
Yes, sir.
Yes, sir.
So just one more doubt. When can we raise the hands? After the question gets completed or after all the options have been told?
Question 1. Your time starts now. At that time, you'll raise the hands.
Okay, sir.
Everybody, first I will flash the question and then I will announce your time starts now. The moment you hear your time starts now, you will raise your hand. Is it clear? And the computer has a system which will log in time wise, nanosecond wise, who's the one who has logged first. Is it clear?
Okay, sir.
Okay. So Raghav, Geeta, Nandini,
Sir.
yeah. Okay. So all the very best to you. We hope technology behaves well with us and doesn't put us in a
Sir, except V5, I think others can mute so that there will be less discrepancy, sir.
Yeah, possible. No, but then in case you want to discuss with somebody, then
Yeah, sure. Okay, sir.
right. Okay. So let's go by question number 1. Which drug was researched in Ramana trial? Your time. Okay. Yeah. Team Nilima, please put your hand down. So you got the hang of it, right? Okay. Here is question number 2. Indian Association of Palliative Care was formed in which year? Your option starts now. TMH has raised the hand already. TMH has raised the hand. One.
1994.
Sorry?
1994.
Okay. Let's see whether it was in 1994. Absolutely so much. Yeah. Hands down. All of you hands down. Dr. Stanley, please put your hand down. Dr. Stanley, put your hand down.
Yeah.
Okay, thank you, sir. Hello.
Team 1.
Team 1, correct. What is the answer? Yeah, please answer. You're from Delhi only.
Chronic fatigue syndrome.
Chronic fatigue syndrome. Correct. Absolutely. Right. Yeah. All of you put your hand down. Hand down. We got the answer. Okay, everybody down? We now go to question number 4. What is SWOT analysis? Raghav Gupta, raise hand first. Raghav Gupta, raise hand first. So yeah. Yeah, Raghav, go ahead.
The strength.
Yeah, you already said.
Answer is already
Answer. The answer is disclosed.
Okay. Right. Okay. Fine. Raghav. Okay. That.
Yes. But the answer was displayed already.
No, before that he answered. I heard him.
No, it was simultaneously
sorry, sir. It was displayed already.
No, Prasoon, I heard the answer. Okay. We'll go to the next one. Okay.
Everybody put your hands down. Team 5, TMH, Nandan.
Shall I answer, sir?
अभी तक question read नहीं हुआ है. So just
Yes.
put your hands down.
Please.
What's the question read?
States in India which have Shanti Aveda Southern Auspice.
Okay.
everybody put just lower your hand, and we will read again, and we will again see who has the answer.
Correct answer is Maharashtra, Delhi, Goa. They answered already.
Sir, yes, I told Mumbai, Goa, and Delhi.
Yeah, it is not Mumbai. It is Maharashtra state. We did not ask city. Hello. Who answered this question?
The team one.
Sir, Dr.
Answered, sir, but she said
Yeah. So we are talking which state? Mumbai is not a state. Mumbai is a city.
Yes.
So
Yes, sir.
what about one? We wanted only three, right?
Yes, sir.
So it has to be three states: Maharashtra, Delhi, Goa. So nobody gets it.
Just wait, sir. Just everybody put your hands down first.
All of you put your hands down.
Let them give some time to put their hands down. Stanley, sir.
Stanley, sir, can you please put your hand down?
Okay. So just you will read, sir, question, and then after that they will raise the hands.
Yeah. Please raise your hands only after I have finished reading the questions. Okay. Question number 6. In preterm and neonates, sucrose is used for. Start.
Team 1.
Yeah. Neonates is the answer given by team 1. Pain management and analgesic effect for 3.
Procedural analysis.
Yeah.
So many questions.
There is eco. Maybe somebody has said what 3 members.
Can I request you all to please hear the background? There is too much of noise coming in. Is this answer can be taken? Pain management, analgesic effect? Yes, Pallavi and Sharik.
Yes, sir.
Okay.
Yes, sir.
Okay. All the hands are down. I'm going to question 7. You will raise your hand only after I finish reading the question. Seriously, this time I will disqualify if I find any team member raising the hands before I say. So here you go.
Sir, only
So all the answers and questions are being.
Okay. Raghav, you have to be very, very mindful. Please do not raise your hand before I say, you know.
So we'll cancel this question, sir.
Okay. Okay.
Even next 2 questions are also shown, sir.
Let's see. Let's see.
Hello.
Yeah. So I'm going to
go slow. So just go slow. Okay.
All of you raise hand now. Pigments causing purple urinary bag syndrome are. Dr. Bharat Bhai. Yeah, so Dr. raise hands first.
This answer was already shown, sir.
The answer was already shown, sir.
answer was already shown.
Indigo something.
Answer was already shown.
Okay. 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 What about this? Question 9. Okay. Painful syndrome characterized by an abnormally painful reaction to a stimulus, especially a repetitive.
Sir, hands are already up. Some people's hands are already up.
Yellow day nahi hoga na.
The answer up is because you're not putting the hands down. Yeah. So Stanley sir, please put your hand down. Stanley sir, please put your hand down. They are not putting the hands down after they raise. So nobody is now raised hand. A painful syndrome characterized by an abnormally painful reaction to stimulus, especially a repetitive stimulus, as well as an increased threshold. See, Bharat Pallavi, you're disqualified. Nandan, you're disqualified. Raghav, you're disqualified. And Gegal disqualified, and Nimish disqualified. Seema is also. Your time starts now. Okay. Team 2 raise hand. Team 2.
So the answer was shown. Answer was shown.
Answer was shown, sir.
Answer was shown.
Sir, question 10 answer has been shown, sir.
Okay, so finally question number 10.
Sir, answer shown, sir.
This also answer is shown?
Yes, sir.
What was the answer?
What is the answer then?
Sir, I didn't notice the answer, but it was shown.
Don't.
No. So what is the answer actually?
Oh, everybody hands down. Everybody hands down.
Raghav, just keep your hands down. Nimish, Seema madam, Stanley sir. Okay.
Okay.
So, Ganpati sir, just read the question.
So one of our member is waiting to be let inside.
Who? Why is the person coming so late? Why is the person coming so late?
He got disconnected, sir.
हो गया. Hello. Has everybody come in? Now can I go ahead?
Sir, one doubt.
Yeah.
Sir, after you finish the question, that time we have to raise hand, or after you say that
How many times
now
I
the
tell
time
you
is over?
simple English? Only after I have finished reading the question, I will say raise hand. That time you'll have to raise.
Yes, sir.
The confusion is because of this. You people don't hear correctly. Are you now clear? Hello, are you clear now?
Yes.
Is everybody clear for this last question? After I have reading the question, when I say raise your hand, that's the time you have to raise. 64-year-old lady has advanced ovarian cancer with metastasis, has developed ascites with symptoms of nausea, vomiting, abdominal pain, and distension. What is the most appropriate next step in management of her ascites? So there are 4 answers. I don't know. See, Nilima disqualified, Bharat disqualified, Nilima and Bharat are disqualified. Okay. Commence spironolactone, furosemide together, perform paracentesis and drainage of ascitic fluid to dryness, perform paracentesis of ascitic fluid
Question के बाद पढ़ा अभी options.
and remove drain. Perform paracentesis with drainage of ascitic fluid to maximum 5 to 7 liters with concomitant intravenous albumin and then remove drain. Raise your hand.
Nandan.
Okay, Nandan.
Answer D.
Which one? Which
D.
one? D for Delhi or B for Bombay?
D for Delhi. D for Delhi.
D for Delhi. Okay, sir. Show the answer, sir.
C, your answer is wrong.
Sir, maximum drain is massive. We have to give albumin.
Correct. Nowadays, is not.
So the question has been taken from the journal side directly. So it has been shown that there is no role of giving albumin in patients whom we have to drain the therapeutic fluid.
Yeah, correct.
So you got this. So I have given the reference for that also.
Yeah.
All of you hands down. So this got. Okay, Shreni, before we go ahead, you have to decide how should we deal with the answer.
Yes, sir.
Should we
there are actually 3 questions which has been barred because the 3 questions answers has been already been displayed. So we are barring these 3 questions in buzzer round. Okay.
So
Even the question 7, 8, and 9.
Pallavi,
Yes.
please go ahead with the scores.
Yeah. Okay. For the first round, team 1 scored total score was 20. For the team 2, it was 30. Team 3, 30. Team 4, 30.
Okay.
And for the second round, teams 1 scored 30. Team 2 scored 20.
Yeah.
And none of the other teams scored anything.
Okay, 0.
So the team 5 will get 3 questions which has been remained in the round 1.
Yes, sir.
And we will then finally decide the score.
Yeah. Pallavi, what is team 1's round 1 score? Second round score?
Team 1 second round score is 30.
3-0.
And team 2 second round score is 20.
Yeah, team 5 round 1 ka score?
Team 5 round 1 ka score is 10.
10.
But the 3 questions are remaining.
3 questions बचे हैं team 1 के, so we will ask the 3 questions and then we will decide.
Okay. Or
So, sir, Bharat sir, is it okay for you?
Yes, sir.
Okay. Nandan, just put your hands down. Okay. So we'll go to the next round.
Round 3.
Yeah. So just go slow.
Yeah. Don't worry. It's not fast. Okay. Round 3. This is a
picture perfect round.
Perfect round. So the rules are: it's a team round. Each team will be shown 3 images, one after the other. After you have answered first image, then second image, then third image. Correct? Totally, we'll complete this 1 minute per image. One alone can give you chance to attempt question 2. That means each image will be accompanied by 2 questions. So question 1 will be shown to you first. If that answer is right, then we'll go to question 2. Is it clear? And all correct answers 20 points, no negative marking. Any doubt?
If the answer of question number 1 is wrong, then?
Madam, is who's asking this question?
So, sir, if the answer to the question number 1, question 1 is wrong, then we will not go ahead for the second question.
Who's asking this question? Hello. If the answer to question number 1 is wrong, or if you cannot attempt question number 1, then you will be out of that image. You will not. Is it clear? Hello, is it clear?
Yes, sir.
No, the lady who asked the question, I want her to answer. So this is the
Sir, I
first.
have a doubt, but can we get the second image if we are not answering the first image?
Dr. Kargoli, let me repeat. Now, team 1, first image will flash. After that, I will show option 1. You have to answer, attempt that question number 1. Only if the answer is right, then we will allow you to attempt question number 2. If you are not able to answer question number 1 for any reason, that means you have lost a chance for that first image. Is it clear now?
Yes, sir.
Karpagoli, are you clear? Is this
Yes,
correct?
sir. Yes, sir.
Now, do we have the answer for question number 1 immediately?
So just go slow, sir.
Yeah. So here we go. Question number 1. Identify the figure, the person in this figure. Team 1, please answer. You have 10 seconds for this.
30 seconds, sir.
30 seconds, sorry. 30 seconds for this.
अगर पास ऑन होता है तो
Sorry? Time over. No, please, can you be a little louder? We couldn't hear you.
That was not from our team, sir. Someone mic was on. Sir.
So, yeah, please. Time up. Time up. So, team 1, do you want to know the answer, correct answer for this?
Vycross?
Sorry? Not Vycross. So, anyway, I'll show to you. Okay. Is it clear? So, you lost. Right? Hello?
Sir, we are able to hear you, sir. We are able to hear you.
Yes.
So, team 1, image number 2. Question 1. Identify the figure. Identify this figure.
What is exactly this is?
10 seconds over. So sorry.
Forest plot.
We want to, so forest plot, sir. So
Forest plot.
Forest plot, sir.
Okay. Right answer. Then, sir, go to the question 2.
Yeah, we know. The correct answer is forest plot. And the second question, what is the other name for this figure? It is boblogram. No, they can't answer. You lost.
We got the answer, sir. So we got the answer, sir.
So, sir, team 1 has already got the answer, so they will get this mark for this question.
Oh, did they say forest? I could not hear at all.
Yeah, they have already presented the forest plot.
Okay.
So, sir, just 1 minute. Just a second. I just have to ask team 1 whether anybody of team 1 know about the other name of this forest plot.
No, sir. No, sir.
You are run out of the time.
So, we will give 10 marks to for
Yes, sir.
because you have answered the.
Yes, sir. Yes, sir. Because the
Question,
answer was
right?
already told. So because the answer was already
Yes.
told.
So, sir, question number 3, sir.
Okay. Now we are going to question 3. Okay. Question number 3. Identify the given image. Your time starts now.
Oral thrush. Oral thrush.
Okay, right answer. So just go to the other question, sir. B.
Wait, Shrenik, you don't come in over there. First answer is correct.
Candidiasis
Yes,
of
sir.
the tongue, sir.
Okay, candida infection correct. So you get an opportunity to answer the second question. Treatment.
Antifungal, cotrimoxazole, nystatin.
Okay.
All right.
Or systematic, you can give fluconazole.
Right, ma'am.
Right. So you got out of the 3 images, one got correct answer for the last image, question number 3. Okay. So 20 marks.
And one.
And
Sir,
second
for question number, yeah. Yes.
Okay, but nonetheless, we'll give it to you. Okay. All right. So now we move to team 2. Team 2, are you ready?
Yes, sir.
Okay. See, answer picture question 3.
So this is for the team 2.
Identify the which was the country to implement the policy related to this person.
Netherlands.
Very correct. Bang on. So you got both the options correct. So you scored 20 points. Okay. Image number 2. Okay. Identify the image.
Stages of grief.
Sorry?
Stages of grief by Kubler-Ross.
Okay. Very good. Yeah. Who proposed this?
Yes.
Very good. So that's again bang on. So we go to question number 3. Identify
Pressure, sir.
Stage of
quick 4 more seconds.
Stage 4.
For stage 4. Okay. Is it stage 4? Yes, that's the correct answer.
Yes.
Three images right, and they've got all the 6 questions correct. So that makes 60 points. So here we go to team 3. Given clinical model is for what?
Dyspnea, breathing difficulty.
Dyspnea, breathlessness. Very good. Correct. So proposed by whom?
Cycross.
Sorry?
Cycross.
No, wrong. No, wrong. So you don't get any point. Okay, I'll show the correct answer.
Yeah. So they will get a point for correctly answering question 1. Answer A.
No, yeah, answer A, right? And it is Anna Sfatis et al. Okay, yeah. So you get 10 points for answering question number 1. So for next question, question 2 now. 43-year-old man smoker recently diagnosed CA lung, dry cough on antibiotics, worsening cough, dyspnea, pressure in head. Okay. Question 1. CT scan shows what? Sorry? What does the CT scan say?
This thing, cavernous sinus thrombus.
No, can you be a little louder? 3 more seconds you've got. Can you be a little louder?
Just give some time, sir. Just I know they can answer.
You wait, Shanik.
SV, superior vena cava obstruction.
Yeah, correct. Superior vena cava, correct. You're right. So your question A is correct. B, name any 2 classification of above diagnosis. Five seconds. Name any 2 classification. Time out.
Anybody knows the answer?
We will show you the answer. Nobody knows. So anyway, your time up. So we are showing you the answers.
NCI, CTCI.
It is Doughty Sanford's classification. Bixby and Hughes. Okay? Right. Question 3. Last image for the team. Are you ready, team 3? Hello, team 3. Are you ready?
Yes.
Yes, sir.
Identify this person.
Stephen Hawking.
Stephen Hawking. Brilliant. Brilliant. Absolutely. Okay. The disease that he suffered from.
Motor neuron disease.
Sorry?
Motor neuron disease. Lou Gehrig's.
Muscular dystrophy.
Specific?
Amyotrophic lateral sclerosis.
Wonderful. That's the name. Perfect. So that gives you 20 points. Okay. Question number 3. So our answers are correct. Stephen Hawking and ALS. Amyotrophic lateral sclerosis.
I said Lou Gehrig's disease. It's okay.
So you are very feeble. So maybe because of the internet or something, we're not even here. I'm sorry.
Oh, sorry.
Yeah. Team 4.
Yes, sir, we are ready.
Ready? Thank you so much. Good luck. And here we go. Identify this person.
Dame Cecily Saunders.
Wonderful. Who can not identify her? Okay. So Cecily Saunders. B. Next. Any one of her contributions.
So she started this hospice movement.
Wonderful.
Started hospice also in Christopher's.
Yeah. Any other contribution you remember? This is correct, but okay. All right, fine.
Total pain concept or total pain.
Yes. So you're absolutely right. You have no choice but to do the points. So Dame Cecily Saunders and modern hospice or concept of total pain. Okay. So now question 2, image 2. Need to start.
Bristol chart, sir. Bristol chart.
Absolutely. Very good. So you become eligible for B. Senna Dokuste is which type of laxative?
Senna Dokuste, sir. Senna is stimulant.
Very good. Bang on. So you're right. Bristol chart and stimulant laxative. So we go to the last image for you. Question number 3. Identify this picture.
So this is marijuana, sir. This marijuana plant, sir.
Can you be a little more specific?
Cannabis.
Yeah, that's right. So, so you get a chance to answer the question also.
Yes, sir.
What component of this is responsible for psychoactive effects?
What component means, sir? What component is what? We means a part of the plant, sir.
Time up.
Sir, the plant leaves.
No.
Not the part of the plan.
Now your time up. Sorry. Wait. Okay, so I'm giving you the two correct answers. Of course, the option A answer was correct. So this is cannabis sativa plant, hemp plant, and component delta 9 tetrahydrocannabinol THC.
So this was not specifically.
Okay, right. So now we go to the last team, team 5. Team 5, are you ready?
Yes, sir.
All right. So team 5, here is the first image for you. Identify this person. Who's he?
Don't know, sir.
Don't know. Okay. So you don't get eligible to the next, but however, you know the answer. I will give you the answer. Okay. The person is John Bonica, Sicilian American geologist. Hello.
Yes, sir.
No, there's too much of background. I can see people laughing. Right. So, founding father. We'll go to the image 2 now. Question 2 to team 5. 40-year-old man, history of lung carcinoma, visited emergency department with complaints of shortness of breath, pain in his chest, weakness, and a dry, irritating cough. His vital signs are, as you can see, 142.82, 118 respirations, and 38 labored and shallow 38.9 degrees. His chest X-ray shows large left white patch. So the first question is, it's your what? What does it show you?
So maybe an effusion, maybe consolidation.
No, don't tell me maybe.
Effusion.
Sorry?
Effusion.
You're right, but a little more specific.
Pleural effusion.
Pleural effusion.
Bang on. Yeah. So here is the B. And what is the treatment?
Paracentesis.
Sorry?
Drainage.
What was the first thing you said?
They said it paracentesis with antibiotic cover.
No.
Sir, drain करेंगे.
Yes, just be specific. Use the specific terms.
ICD, please.
ICD
placement with fluorosis later on.
Medical term, last 2 seconds.
ICD intercon.
ICD placement with fluorosis later.
No.
No, sir.
Thoracentesis.
Answer is correct.
Thoracentesis.
Thoracentesis on the ICD placement, his answer is correct.
Okay.
Thank you, sir.
So last image, you're adjusting pleural effusion and thoracentesis. So this is image 3. Identify the instrument. Hello, time.
Bone marrow aspiration needle.
No, wrong. Sorry.
Somewhat trocar for.
Wrong. One more second. Try.
True cut biopsy.
No, wrong, please. So you don't become eligible for third one. It is for jaw opening key, Heister jaw opener, and it is trismus. Okay. So we finished all the 3 image round, and we are now heading towards the last round. Okay. Yeah. Scores, please, Pallavi.
The scores for this round for team 1 is 30, team 2 60,
yeah.
Team 3 40,
yeah.
Team 4 50.
How much?
Team 5.
Team 4?
50.
Okay.
Yeah. Team 5 20.
Okay. So
Can you repeat for the scores?
Sorry?
Yeah, the team 1 score is for this round is 30.
Yeah.
Team 2 60.
60.
Team 3 40.
Yeah.
Team 4 50.
Yeah.
Team 5 20.
Right. Thank you.
Yeah.
So, ladies and gentlemen, we have come this far. So hold your breath and be ready for the next and the final round. And as the quiz master, Dr. Shenig, has mentioned, whatever technology proof up happened for Team 5, we'll give you a chance with other questions. Is that fine? Okay.
Yes, sir.
So this is a rapid fire round. So there has to be absolutely fire in your belly. Yeah. And therefore, the rules are, it's a team round. Each team will be asked 10 questions. And this entire 10 questions will have to be answered in 3 minutes time. It will be an open-ended question. There will be no multiple choice question pattern. Then skip any question if answer not known by saying pass, so that the quiz master can go to the next question. Depending on availability of time, the team can get chance to give answers to unanswered questions. So suppose if you finish all the 10 questions within, let's say, 2 minutes, and you still have 1 minute with you, and there are 2 or 3 questions you could not answer, the quiz master will come back to you in that 1 minute for the questions for a second try. No negative marking, so that's a breather. So each correct answer will give you 10 points. So this rapid fire rounds can get you up to 100 points. Is the rule clear? Team 1, team 2, team 3, team 4, team 5.
Yes, sir.
Yes, sir.
All right. Team 2, are you clear about this rule? Team 2.
Yes, sir. Yes, sir.
Okay. Team 3.
Yes, sir.
Team 4. Team
Yes,
5.
sir.
Yes, sir.
So let me give you a bit of a alertness, like how you had a spokesperson for the previous round. If you think that is going to help you, you can have the same, so that one person answers rather than then you don't feel bad about A answered correctly. Okay. And then we'll also be in a state of confusion. Will this team okay to nominate a spokesperson who will represent their team? Is it fine?
Yes, sir.
Everybody, I want all the team to say.
Yes, sir.
Yes, sir.
Yeah. Yeah. And we would want to mention the name. So team 1, Raghav, can you give me the
Yes,
name
sir.
from your team?
So myself, Sir Raghav, sir.
Okay. Team 2,
Yotsna.
Jyotsna will answer. Team 3,
Sangeeta.
Team 3, Sangeeta will answer. Hello, Team 3.
Sangeeta, sir.
Okay, Team 3, Sangeeta will answer. Team 4,
Dr. Nandan, sir.
Dr. Nandi. Team 5,
Yeah, Dr. Bharat Paliwal.
okay. Team 5, Dr. Parat. Okay, so I repeat, Team 1 will be Raghav. Team 2 will be Jyotsna. Team 3 will be Sangeeta. Team 4 will be Nandan. Team 5 will be Bharat. Correct?
Yes, sir.
Yes, sir.
So as soon as I finish the round, I'll consciously call that spokesperson only. Okay, so others please do not interrupt. So for example, I'm going to start with team 1. As soon as I finish the question, I will say Raghav. Okay, that means his team's time starts now. So are we all ready to go?
Yes, sir.
Okay, just set, and here you go. Rapid fire round. Team 1. Question number 1. In goal setting using SMART approach, what does A stand for?
Pass.
Raghav.
Pass.
Pass. According to cachexia score, percentage cutoff for body weight loss to label as severe cachexia is Raghav.
Pass.
Pass. Anti-emetic drug of choice in advanced cancer with high level of confidence is Raghav.
Ondansetron.
Sorry?
Ondansetron.
Ondansetron. Okay. 4. Which test of significance is used to compare more than 2 groups? Raghav.
Pass.
Pass. NDPS Act was amended in which year?
Pass.
Okay. 6. Most common side effect of vitamin B12 supplementation is?
Pass.
PSQI is an effective instrument used to measure?
Pass.
Maximum permissible dose per day of E-aminocaproic acid is?
Pass.
Palliative sedation is the administration of opioid drugs to sedate a terminally ill patient to unconsciousness as an intervention of last resort to treat severe refractory pain or other clinical relieved by aggressive symptom specific palliation. True or false? manner of death?
Pass, sir.
Okay, so you have got another 1 minute with you. Can I come back to you with the questions again?
Yes, sir. Yes, sir. Yes,
Yeah.
sir.
Okay, so I'll go. In goal setting using smart approach.
Attainable.
Attainable. Okay. Please note this, Pallavi. According to cachexia score, percentage of cutoff for body weight loss is to label as severe cachexia is?
Pass, sir.
Okay. Antiemetic drug of choice in advanced cancer with high level of confidence is?
Haloperidol, sir.
Haloperidol. Okay. Right. I think your time is over. So we are done with team 1 rapid fire round. Okay. So now do you want to see the answer? Answers. Question number 1, attainable. Your answer is correct. Question number 2, 15%. You did not give the answer. Question number 3, metoclopramide. Your answer was wrong. Chi-square test, 4. You did not give the answer. 22nd February 2014, you did not. 6, hypokalemia, you did not answer. 7, Pittsburgh frequency, you did not answer. 30 gram per day, you did not answer. 9, false, you did not answer. Okay, 10, suicide, you did not answer. So how many you got correct? Only one question, attainable.
Only one mark.
So the first rapid fire round, team 1 managed to answer question number 1. Is that clear?
Yes, sir.
Okay. Gaurav.
Sir, actually, you were reading again the answers, questions. I mean, in that we missed.
Yeah, naturally, because we had time. No,
I mean, we could just have told that we know this question, like questions.
No, that's okay. That's perfectly okay. How do I know that you all will know? I will not know, no?
Yes, sir. Like this is the disadvantage of the team 1, I think.
No, there's no disadvantage. Please, it was made very, very clear. I don't think you all were there during the walk around. It was all okay. Now, how am I supposed to know which question you remember?
So we could have told the question.
It is not that anything is intended, ma'am. Okay, team 2. Team 2. Questions, team 2. Team 2, are you ready?
Yes, sir.
All right. Mechanism of action, enamorelin is?
Ghrelin agonist.
Sorry?
Ghrelin agonist.
Question 2 pass. Question 2, a person who's ambulatory and
Sorry.
Self-care but unable to carry out any work activities up and about more than 50% of waking hours. Identify his stage of ECOG performance. Jyotsna.
ECOG 2.
ECOG 2. 3. Gate control therapy of pain was proposed by Jyotsna.
Second wall.
Okay. 4. Silence randomized clinical trial was done for which condition? Jyotsna.
Death rattle.
5. Maximum recommended dose per day of tranexamic acid is? Jyotsna.
Pass.
Antidepressant useful in refractory cough is? Jyotsna.
Amitriptyline.
First line antiemetic for chemical was cause of vomiting is?
Haloperidol.
Okay. NSAID with lowest risk of gastrointestinal risk is? Jyotsna.
Celecoxib.
Next. Lubiprostone used for chronic idiopathic constipation acts on potassium channel. True or false?
False.
Okay. Last question 10. An unconscious psychological mechanism that reduces anxiety arising from unacceptable or potentially harmful stimuli is called?
Ego defense mechanism.
Okay, ego defense mechanism. So you did not get.
What was the first question?
First question. Mechanism of action of enamorelin is?
Ghrelin agonist.
Okay. I think that was only one question you did not answer.
A fifth question we did not answer.
That is antidepressant useful in refractory.
No, fifth question, number 5.
Number 5. Recommended dose per day of tranexamic acid is?
3 gram.
3 grams. All right. So we are done with that. So now, are you guys ready to listen to your answers? How many questions are right? Okay. Answers, team 2. Ghrelin analog. Yeah. So was that correct answer? Yes. Yeah. ECOG 2 was correct. Melzack and Wall 1965 correct. Terminal respiratory secretions of death rattle correct. 8 gram per day wrong.
Okay.
And amitriptyline. No, sorry, correct. Haloperidol. Correct.
Oh my God.
False, correct. And 10 ego defense mechanism correct. So how many you got correct amongst all that?
Nine.
So,
Nine.
9 of it correct out of the thing. Okay, good show, wonderful. Team 3. Yeah. So who's the spokesperson? Team 3, Sangeeta. Okay,
Yes, sir.
Sangeeta, are you ready?
Yes, sir.
Okay. Question number 1. Your time starts now. Modern palliative care in India was introduced in which year?
Pass.
The time period in silver hour is comprised of?
Pass.
1 hour.
Which phase of clinical trial assesses effectiveness of an intervention? Sangeeta. That scale is used to assess what?
Pass.
Anticonvulsant used for treatment of cough is what?
Gabapentin.
Gabapentin.
Okay, next question. Antifibrinolytic agent having no effect on platelet count is?
Pass.
The variables whose measurement is done in terms of height, weight, and length are classified as?
Pass.
FDA approved commercially available cannabinoids is?
Pass.
Dextromethorphan act through NMDA receptor. True or false?
True, true.
Okay, true. Question number 10. A 40-year-old woman attends chemotherapy daycare unit for a monthly chemotherapy. Each time before chemo, she gets intermittent nausea, palpitation, and abdominal discomfort. Her recent restaging scan showed that her cancer has responded to treatment. She is keen to get her nausea controlled. What is the most appropriate anti-emetic for her?
Ondansetron.
Okay.
We are giving options for that also.
No, there is no option.
Yeah. There are options, sir.
Cyclism,
Phenergan.
lorazepam, and ondansetron. Which one?
Cyclizine.
C. Option C, Sangeeta?
A.
Okay. Cyclism. Okay, fine. So we are done. So do we have any time for? Do they have time for repeat questions?
Yes.
The first question, it is 1994.
1 minute left. So what is the answer? Okay.
Sir.
Yeah, first one. Modern palliative care was introduced in which year?
94.
1994.
1992. The time period in silver hour comprised of?
1 hour.
1 hour.
So, sir, be specific. 1 hour means what?
Which phase of clinical trial assesses effectiveness of an intervention?
4, sir. 4. Clinical. 4.
Pain at scale is used to assess?
Dementia.
Anticonvulsant used for treatment of? Okay. Last one for you. And antifibrinolytic agent having no effect on platelet count is?
False.
Okay, that's it. Time up. So we look at the final answers that you have given. Let's see how many you got correct. Okay. Answer team 3. 1986 in the form of Shanti Avedana. Number 2, 30 minutes before and after death. Phase 3. Answer 4, pain in dementia. Answer 5.
They have answered half.
Yeah.
Dementia was good.
Yeah, okay. Gabapentin. 5. 6. EACA, E-aminocaproic acid, ethyl and continuous variables. 8 is dronabinol and nabilone. 9 is true with the answer. Lorazepam, 10 is a C. So this is the answer. So
sorry.
Yeah, later on you went with cyclizine. Correct. No. So it is wrong. Yeah, cyclizine. Okay. Team 4, are you ready?
Yes, sir.
Team 4, fast. Okay. Just a minute. Can you bring the charger from there and connect my battery? Fast. 1 minute. 1 minute.
நாங்க மழை இப்படி பெய்யுது.
All right, before we go, team 4. Okay. Yeah. Time starts. Antifibrinolytics are generally contraindicated in.
Sir, something happened.
The way
True, sir.
you
True.
நீங்க இதை போட்டு சாப்பிடணும்ல அந்த கோவில்
Something happened to the screen.
Host have gone.
Hello, am I audible now? Hello, am I audible?
Yes.
Am I audible?
Yes, sir.
Hello, am I audible?
Yes, sir.
Hello, am I audible? But the
Yes,
participants
sir.
are not audible. Hello,
Sir,
can
you are
somebody tell me if
audible.
I'm audible?
Yes, sir.
Telling, am I audible?
Sir, you.
Yes, sir.
लेकिन इनको नहीं आ रही है, पार्टिसिपेंट्स को नहीं आ रही है, रिस्पॉन्ड ही नहीं कर रहे हैं. अच्छा, so team 4, are you guys clear?
Yes, sir.
Team 4, who's going to answer? Suchita is going to answer, is it?
No, sir. Nandan.
Nandan.
I'll be answering.
Team 4, can I start now?
Yes, sir.
Yeah, please look at the time. Question, your time starts now.
True.
True, correct. Question number 2. Drug used for terminal respiratory secretions or death rattle.
Hyacinth butyl bromide.
Okay.
Or
Three. Non-analgesic use of ketamine in which condition? The type of variable which can take fixed integral value is classified as? Please say pass. Target rate for INR in patients on oral anticoagulant is?
2 to 3.
Sorry?
2 to 3.
2 to 3. Okay. Nandan, be a little louder. Feel good hormone is? Antidepressant used for paraneoplastic sweating is? Nandan?
Sir, pass.
NSAID of choice for patients taking aspirin thromboprophylaxis for stroke is? Nandan?
Pass.
Oxygen pulse diagram is used to assess what?
Sir, dyspnea, measuring dyspnea.
Dyspnea. Okay, 9 is dyspnea. 10, the scientific exploration of abnormal mental state is called?
Pass.
Over. Your time is over. We've got last 1 minute. Okay, I will go backward.
Yes, sir.
Okay, I'll go backward now. Antifibrinolytics are generally contraindicated. True or false?
True, sir.
True.
Sir,
Drug used for terminal respiratory secretion. or detraction?
Hyosin butyl bromide. Non-analgesic, sir, anesthesia. That is same thing.
Wrong. I mean, sorry. Go ahead. Non-analgesic use of ketamine in which condition?
So refractory epilepsy?
The type of variable which can take fixed integral values classified as?
Sorry, no, sir. Next.
Target range for INR in patients on oral anticoagulant is?
2 to 3, sir. Next.
Okay, your time is over.
Sir, one question I know, sir. I think I know, sir. Next question, sir. One. You didn't.
No, but the time is over. 3 minutes over.
Sir, endorphin, sir. Endorphin was the answer. One question.
I'm so sorry, Nandan, but the time is over.
Yes, sir.
So, you want to see the answers?
Yes, sir.
Team 4. First answer is true. Second, glycopyrrolate was the second answer. 3 is depression. 4 discrete variables. 5 INR 2 to 3. Yeah. Okay, serotonin, dopamine, oxytocin, endorphins. 7 is amitriptyline. 8 is celecoxib, naproxen. Impact of breathlessness. 10 is psychopathology.
So for 9th, I will give the half pass because he has answered partially.
Okay. Okay, so Pallavi, can you give the total score for team 4 for this round?
So 35.
35. Okay. Okay, we are now in team 5, the last team, the last round. So that's going to be the grand finale of this, rapid fire round. Can we start now? Who's going to answer?
Yes.
Team 5? Bharat. Bharat is going to answer.
Yes, sir. Yes, sir.
Yeah. Okay, Bharat,
Yes,
are you
sir.
ready? Yeah. Okay.
Yes, sir.
Good. So here you go. Questions. Who was awarded Padma Shri Award in 2018?
Father of palliative care in India.
Sorry?
Shanta.
Dr. Rajgopal, sir.
Dr. Rajgopal. Okay. West Haven classification is used for which condition?
Pass, sir. Pass, sir.
Secretion of saliva is known as? Pass. Okay.
Pass, sir.
Methenamine epurate is urinary antiseptic. True, false?
Pass, sir.
Okay. Class of antidepressant drugs associated with higher risk of suicidal ideation and non-fatal self-harm is less than 25 years of age.
Pass, sir.
Third order neurons in pain pathway are located in?
The hypothalamus.
Okay. Gynecomastia is a side effect of which antiemetic drug?
Ondansetron.
Sorry?
Ondansetron.
Okay. 8. Example of preferential COX-2 inhibitor is?
Celecoxib, Raficoxib.
Okay. Conversion ratio between morphine. Okay, pass next question. Recommended dose of zoledronic acid in patients with creatinine clearance of 40 to 49 ml minimum is?
Pass, sir.
Okay, so you got how much? Yeah. So we'll go back to your question. Okay.
First answer, second, don't know, sir.
Next, excessive of saliva is known as?
Hepatic enzyme.
Is urinary antiseptic.
West Haven hepatic enzyme.
West Haven is hepatic and care.
Associated with higher risk of suicidal ideation, non-fatal, self-harming, less than
20.
Okay. Oh, that's it. That's it.
Thank you, sir.
Okay, thank you. So with that, we finished the thing. Now we'll go to team 5. Thank you, Bharat. Team 5, the last. Okay. Ravi, can you tell us the score for team 5?
Correct answer 20.
I can't hear. There is so much of background trouble here. Pallavi.
I heard that someone answered the hepatic encephalopathy.
is 30.
What is the team 5 rapid fire round?
3-0.
Sir, can answers be displayed, sir?
Which one?
The answers can answers be displayed, sir?
Yes. We'll show you the answers.
What is the
30.
Sir, the score is 30.
No, sir, please display the answers, please.
What is the total score?
Sir, can you please display the answers?
Answers, I want to
Yes, we will show you the answers.
Yeah.
50-50, right?
Yes, sir.
Pallavi, is it 50?
Bharat?
Yes,
Dr.
madam.
Bharat?
Yes, madam.
Can I request?
Answer 5 questions, I think.
Somebody is talking from double. Hello, somebody is talking from the double. Other than Pallavi, buzzer on. Now it is 15-5. Can everybody mute? Can everybody mute? We are coming to the end of this. We are already overshooting time, so we have to go to team 5 for the first round.
Yes, sir.
The tiebreaker question. इससे पूछ लो. ना, चलिए से पूछ लो.
Sir, please unmute yourself. Ganpati, sir, please unmute yourself.
Mr. Ganpati, you have to unmute.
Ganpati, sir, please unmute yourself.
Is it okay?
Okay, I'll share the screen with PPT.
You got the questions? We have got the questions. Yes, don't worry, we have got the questions.
Okay, sir, then no issue.
Okay. So we are starting this round for team 5. Dr. Bharat Paliwal will answer on behalf of the team. Okay. This
Yes, sir.
was the goof up that happened in round 1 because of the technical glitch.
Yes,
so,
sir.
Can I go ahead with Dr. Bharat, please?
Yes, sir.
Yeah.
Go ahead, please, sir.
I want the technical team to please present the tiebreaker.
Next slide.
Yes, sir. Go ahead, please.
Yeah, go ahead with the next slide. The ability to perceive and to understand the emotional experience of others and to relate in a meaningful and appropriate manner indicates care and compassion.
Is empathy, sir. Empathy, sir. Empathy.
Sir, options.
Empathy, sir.
Dr. Bharat
It's
will
the right
answer.
answer.
Sir, empathy.
Yeah.
Empathy.
The right answer is, sir.
Yeah. Next question. Next slide. Next slide. Okay. Question 2. Model of grief posits that grief is not a linear or stage-based process, but rather oscillation between the two. Can you name it and who has coined this?
किसी को पता है क्या?
नहीं. Grief, model of grief.
Model of grief, sir.
So it's already model of grief. You just have to name the person who has coined this model.
It's a Kubler-Ross model, sir.
Yes. Yes. Yeah. And yeah. Okay. Right. Yeah.
Because
Next slide,
Kubler-Ross
please.
only gave the concept of grief and everything. Yeah.
Yeah.
This is Kubler-Ross.
Thank you. Thank you, Seema Patani. Last question. Next, please.
Next slide.
The quality that enables professional caregivers to cope, adapt, and continue giving and growing despite the tidal surge of suffering that we are dared to confront is called?
Quality of
Professional behaviors to protect and
yeah.
by the tidal suffering.
quality.
You got
So this is
40
after
more.
death?
Sorry?
The bereavement, this is after death, the quality that a professional gives.
Please give us the answer. You got 20 seconds more.
Continue giving and doing this.
Time up. Time up.
Compassion, sir. Compassion sort of.
I said time up.
No.
So is it compassion?
Wait, I'll give you
No,
the
no,
answers
no,
are.
no. We'll get the answers.
Next slide. Answer. So we are giving. Next slide. Okay. Empathy question correct. Answer is correct. Answer for the second question. Dual process model of grief and loss by stroke and shoot. Okay, not elicited loss. And answer for question number 3 is resilience. All right. On this note, we will finish off the
partial marks for question 2.
Sorry.
Partial marks. A option was correct.
2.
Yeah,
we'll
give
you partial marks. We'll give you partial mark.
We'll give you marks.
Yeah, yeah. Okay.
Thank you. Thank you, sir.
Okay, just a minute. So while we close, you take 5 minutes break. Hello. Wait. Well, please tell Dr. Bharat, you said Elizabeth Kubler-Ross. That was the wrong answer. The first one, that is wrong. So you will not get any marks.
First one was empathy, sir. Achha,
that you're getting the stage grief stage. The model was by Elizabeth Kubler-Ross.
Okay, sir. So part B is wrong. Part A is right, sir.
What was the part A answer that you gave?
Kubler-Ross.
So Dr. Seema answered, sir.
Yes,
what she answered?
Yes, sir.
Dr. Seema.
Kubler-Ross.
Okay.
You have answered as a model of grief. It is actually a model of grief. You just have to identify that one.
Dr. Seema Partani had answered this.
Okay.
That is a wrong answer, sir.
Okay, so first of all the participants, thank you very much. Despite the technical glitch, you all put it on very well. You conducted the show. We are apologizing from our side for this, goof up that happened because of various connections and everything. So we have come down with the score, and Dr. Anjum will announce the winners during the valedictory session. So therefore, we are ending this session and we are moving ahead. You want to say something? There's a 5 minutes break. Afterwards, we will start the thing. Shanik, thank you very much. Pallavi, thank you very much. Gaurav,
Can we have the scores? Sorry, sir. Excuse me.
Yeah.
Give me 2 minutes.
Can we have the scores, please? Total scores.
No, everything will be told to you during the validity. If I tell you the score, then if I tell one team, we have to tell all the team, then the winner will automatically be known. So
No, at least the scores we can.
No, we are closing. Okay.
Thank you, sir.
Very much. It was a great show that you all put up. Okay.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, everybody.
Thank you.